Down syndrome is a chromosomal abnormality disorder and it can have a major effect on families. Dr. Manjeet Arora tells us the chances for your baby to have Down syndrome and how it is diagnosed.
Whenever we are talking about the Down syndrome, we have discussed we have various methods. One can look by the ultrasound, one can do the blood markers. They can be done in the first trimester in the form of double test, or they can be done in the second trimester from 15 to the 22nd week in the form of a triple marker or quadruple marker. Here series of markers are taken, and with the help of a software the risk for a woman is calculated. If the risk for Down syndrome comes low, like if it is cutoff we take is 1 in 250, if the risk comes say 1 in 300, 500, 6000, 10,000, we do nothing. But if the risk value falls below the cutoff, like if it is 1 in 200 or 1 in 150, then we go ahead with a test called amniocentesis. In amniocentesis, we take water from around the baby and send it to the lab to look for the karyotype of the baby. This is a sure shot test. Why the need for amniocentesis? Because the screening test may give false positive result in 5% of the cases. Like if we do 100 screenings, 5 patients will give us the value which will fall in high risk category, but then it may not be having actual problem. So when we do amniocentesis and establish that the karyotype is normal, one can continue the pregnancy, and if the karyotype is suggestive of Down syndrome, a case of severe mental retardation, the patient can undergo termination of the pregnancy. But all these things need to be discussed beforehand very carefully, because if a patient does not want termination, there is no point doing this test. They have to be explained that what are the drawbacks of the test and how we are going to manage if the test result is abnormal. Another important test then which is recommended is a level 2 ultrasound scan, which is called detailed anatomic survey of the baby scan, which is done from 18 to the 20 weeks. It is very important to look for any gross obvious malformations in the baby. We look for the placenta, we look for the blood flow, how it is going to the baby, and if there are any problems, then intervention can be done there and then. Then certain optional tests, like if a patient is having bad obstetric history, or she is having recurrent miscarriages, or any other medical or surgical complication, note is made of that, and with the help of multidisciplinary approach or whatever tests are necessary, they are done.
For more videos related to pregnancy and health, log on to onlymyhealth.com.